patients and deaths and everything is going down. That it means I think flattening the curve.
But okay, now very interesting what you said. You almost said everything what I wanted to hear. But
Yeah.
how a number of deaths will be lower if you flatten the curve? Because flatten doesn't mean you reduce number of affected people. You will still have, let's say, in Sri Lanka, 2,500 cases. Even if you flatten means you spread it over the period of time, right? Otherwise, as you said, spikes, right? Use the word spikes. If all people got sick together, it's a different situation than 2,500 people getting sick between 3 months or 2 months. So what is the difference? How it's going to, why it's change in number of deaths?
I'm not getting you what you're saying.
So now, for example, flatten the curve means you still have same number of affected people or sick people without reducing it. So in Sri Lankan case, now we have 2,500.
Yeah. It is not. Let's say that in one country, let's say in Sri Lanka, is
Right.
Once it starts and is going up and up and up, and then getting the the spikes are coming up, and then once you control, that line will be flat. It will not go up or down, or it just keep it like that, because there's no any other the once you go up to the level of, let's say, 10 or 15 or 20 or whatever the amount that deaths and infected people, then if you control it, that
Wait.
in a diagram.
Right, wait, hold on for a second. Now, what do you mean by control?
Control means there's no any deaths anymore, or less deaths.
What about
not?
What about the cases?
Yeah, even cases. Is no any cases reported like in Sri Lanka.
Okay.
The last one.
Chandana, this is not exactly correct. That's why I asked this question. Now, controlling is you manage the manage the disease in a very good, effective manner. That's the difference. But flattening the curve means you don't get, you still get the people, you still get the sick people. The only difference is now, as you said, the curve was like this before. That means you get a lot of people together to the hospital, right? But flattening the curve means you get these people not one day, not 1 week, but across longer period. That means you have to connect this to your ability to serve these people. Now, because when people come to hospital, you treat them and then you send them home. For example, in Sri Lanka, you have seen that people get fully recovered very quickly, right? So that means you have enough beds, you have enough IC beds, right? Intensive care beds, ICU beds. You have enough specialist doctors, nurses to take care of them. But imagine everybody, all these 2,500 came on one day. You have only in Sri Lanka maximum 500 ICU beds. So that is the point. You have to refer this with reference to your, we call this critical infrastructure facility. Even if you have 2,500, even 5,000 across 6 months, still fine. You don't necessarily stop the virus, but you slow down its spread to have the same number but spread across the period. I'm going to show you a video so that you will understand this very clearly. Just a minute. So thank you very much, Chandana, for your explanation.
Okay, thank you.
Yeah.
You're welcome. You're welcome.
How to go back? Okay. So again, I want to highlight you don't reduce the number of cases, but you spread it over the period of time. Okay. Just a minute.
As people are talking about this virus.
Okay, so look at what is flattening the curve explained by experts.
Especially since we've seen in other countries that it can become widespread, like in Italy, there's this notion of flattening the curve or flattening the wave. And what that's referring to is if you think about a wave sort of coming through an area and then moving past the area, think of the wave or the curve as being the number of patients in the community that actively have that infection. Well, a certain small percentage of the people that have that active infection could become more ill and require healthcare services. And so if the wave is very big, then there will proportionally be more people that need healthcare services. And what we want to do is try and flatten the wave so that
just to add here, now this curve is not the aggregate, it's not the cumulative curve, it's a distribution curve, right? It's like a normal distribution. So you see this daily spike, so it's a distribution of course to time, but if you look at the number of total case, it will be like this. Flattening means still you will be like this, but over the period of time. Okay.
That it's within the capacity of our community's healthcare system to handle anything that comes our way, whether it's sick kids that have cough and cold and need attention, or whether it's somebody that's very ill and needs to be in the hospital and treated for pneumonia. So when people hear about that flatten the curve or flatten the wave concept, that's the idea with why we think about social distancing is the more we can slow down transmission of this virus, the slower the onset in the community of this infection, and the more capacity we have as a system to care for everybody's needs as it happens. That's why we're seeing all these changes with the Big 12 canceling tournaments, the NBA canceling games, Iowa State moving online. Everybody's trying to think through in their particular way, how do we thoughtfully decrease the risk of transmission in our community so that we can flatten that wave and prevent going beyond the capacity of our system. There's no question that there's downsides to that process, whether it's sporting events being canceled, students moving online, normal organizations not getting to meet the way they should. We humans, we are social beings, and we do best when we're together with each other. I think we need to just figure this out thoughtfully together. How do we move through this time? How do we flatten the wave? And then as we come out of it on the other side, then how do we start re-engaging those different things in a meaningful and thoughtful way? That's the balance I think everyone's trying to strike. And I think every organization is different and just trying to be careful and thoughtful with what they can do to prevent spread of this virus.
Okay, so you learned that flattening curve is, the idea is to not to get all the...
Our Earth is like a treasure chest. We have to watch over and look after it.
The idea is not to let everybody to get sick together, but slow down the spread so that people become sick slowly. It doesn't mean that you stop the disease. It's still people will get sick, but they will come, let's say, little by, small batches by batches, so that you can serve them in your hospital, in your beds, using your health critical infrastructure, health infrastructure. Okay. Now, since it's clear now, let's look at, the second term I want you to know, or I want to check whether you know, is R naught, reproduction number. Can anybody explain to me what is R naught? That's also important term in understanding any epidemic. What is R naught? Any ideas? Chandan, you want to try again?
No, I don't have any idea about that one.
Okay, that is very important. Some people use this, some countries, for example, Germany use R naught as the main way of managing the COVID-19. Anybody else? Okay, so basically a reproduction number, basically it's called R naught. R is effective reproduction number. R naught is the it's the character of the particular virus or particular that particular pandemic or epidemic, right? So, for example, each epidemic has its own reproduction number. Reproduction number means within the active duration in general, how many people, if I'm sick, how many people I will spread the disease into. For example, if R0 number is 2, that means any sick person will, in average, will affect 2 more people. That is how it's spreaded. Now, if you look at measles, it's a different disease. It has a very high R0 number, but in general, it will affect 20 people. Or even this normal influenza, or, hembrisao. You get normal hembrisao, you get 2 more people. But since it's not affecting much in terms of complications, you won't notice it. But in if you look at COVID-19, normally it is considered R0 is 1.5, between 1.5 and 1. Let's say 2. So that means in general, any sick person in average will affect 1.5 more people. This is a very important number. Now, controlling the disease means you have to reduce this number to less than 1. If you can reduce R0 to less than, let's say, 0.8 or 0.7, that means you eventually spread the outbreak. It will not multiply. I have another example to show it to you, but first let me explain you in a video how this idea of R0 is important in understanding COVID-19.
I'll take away for that. Our lives right now are pretty much controlled by something called R0, also known as the R number. It tells us how many people
we can't.
Yeah. I have to unshare and share again. Wait a minute. You won't miss anything. Let me go from the beginning.
I'll take away for that. Our lives right now are pretty much controlled by something called R0, also known as the R number. It tells us how many people will likely get infected for every 1 person who gets ill with coronavirus. If the reproductive number is 2, then 1 person will probably make 2 others sick, and so the disease spreads. If it's 3, then it'll be around 3. Without a cure or vaccine, this R number guides every decision governments make to fight this pandemic. Before changes were brought in to reduce the spread of coronavirus, its R number was between 2 and 3, which is why it spread so quickly. The aim is for it to be less than 1 and to keep it there so health services can cope. But when R0 is less than 1, we can't immediately switch back to how things used to be. Each restriction that's lifted makes the R number rise, some more than others, but it's not clear how much. And how restrictions are lifted exactly will affect the R number too. For instance, what happens if schools reopen? What if only some pupils go back? These decisions have to be made for everything, and the answers aren't clear. Governments need to carefully balance this need to get countries moving again, while still keeping the public safe.
Okay, so stop this first. Now, if you have studied mathematics, now this is actually any epidemic like COVID-19 can be explained as a model, like a distribution curve. So R0 is a reproduction number is associated with the particular curve. So you can in an exponential curve you can calculate that. This is not medicine. This is mathematics or science. So that is why I take your statistics and mathematics seriously when you are studying your business management, so then you can easily do these calculations. Okay, so this is R0. How many people will be affected by 1 single person in the population? That is R0, and by reducing R0 to less than 1, you can control the outbreak to a manageable level. Now, this model, this concept is mainly used by Germany to control, because Germany was affected heavily, like not like Sri Lanka. There are around, I think, 1 million people, no, 100,000 people were affected, but they were able to manage the concept of R0 applying to society and to close down the society, do the social distance and reopen. So I will show you because I lived and studied in Germany, so I follow what's going on there because I go there every year. Now, German Chancellor Angela Merkel was known, got the respect, unlike Trump or Johnson from UK. They didn't take this seriously, but Germany took very seriously, and the chancellor herself, came and talked to people and explained this concept. Now imagine, of course, Angelica Merkel has a PhD in applied chemistry or something. She's a scientist. But imagine how a leader of the country comes to the television and explain, if you reduce what is R naught and what if R naught is control, how you can manage the COVID-19. So that was highly respected. I will show you that video also.
Die Kurve ist flacher geworden. Es bleibt nach wie
This is in German, but you can see the translation. It's subtitled, so you can also read that.
vor so, sie muss so sein, dass unser Gesundheitssystem nicht überfordert. Und wir haben Modellbetrachtungen gemacht. Wenn wir sind jetzt ungefähr bei diesem Reproduktionsfaktor 1, also einer steckt einen an, der natürlich auch nicht, das kann ich immer nur für eine Infektionskette sagen, ob einer einen ansteckt, das ist dann ein Mittelwert, aber es ist ungefähr einer steckt einen an. Schon wenn wir darauf kommen, dass jeder 1,1 Menschen ansteckt, dann sind wir im Oktober wieder an der Leistungsfähigkeit unseres Gesundheitssystems mit den angenommenen Intensivbetten. Wenn wir 1,2, also jeder steckt 20% mehr, 1,2 an, also von 5 Menschen steckt einer 2 an und 4 ein. Dann kommen wir im Juli schon an die Belastungsgrenze unseres Gesundheitssystems und bei 1,3, das wird nicht viel, wir kommen von 4, 5 Ansteckungen, 3 bis 5 Ansteckungen. 1,3 sind wir im Juli an der Belastungsgrenze unseres Gesundheitssystems. Daran sehen Sie also, in welch kleinem Spielraum wir uns aufhalten. Und die ganze Entwicklung basiert darauf, dass wir davon ausgehen, dass wir eine Infektionszahl haben, die wir überblicken können, die wir nachverfolgen können und dass wir mehr Schutzkonzepte haben und durch die mehr Schutzkonzepte auch mehr Lockerungen machen können. Aber es ist ein dünnes Eis, wie Herr Tschentscher gesagt hat, oder eine fragile Situation oder wirklich eine Situation, in der Vorsicht das Gebot ist und nicht Übermut.
So if I just recap what she said now, German chancellor is like a prime minister or president of that country, right? So
Thank you.
So Chancellor was talking about how they consider R naught as the main factor in understanding COVID-19 and control it. Based on that, now for example, if R naught is 1.5, she said the hospital bed will be completed by October. So they want to reduce it. Now Germany has one of highest, best Medicare center facility in the world, but still she didn't say we can manage it. She said it's very dangerous. We are in a very difficult situation. So likewise, she was appreciated for her taking seriously and explaining that to the people. So that I want to show you how countries who manage it well. I mean, when I say manage, that means not less affected. It was affected heavily. A lot of people got sick, but then still they were able to save people without getting killed. Okay, so that's about German situation. The next concept I want to quickly introduce to you. This is also very important when you are analyzing or understanding the disease. It's called herd immunity. Anybody knows what is herd immunity? Any ideas?
So I think it is the advanceable thing from collective of people.
What is that?
Advisable thing for collective of people to reduce the COVID-19.
I didn't get that. Can you give example?
When the immunity people collecting together, then the positive COVID-19 people reduce.
Okay, so yeah, it is partly correct. Now normally how we normally think is how we think about COVID-19 is to avoid getting sick, right? But there is a one theory says if healthy people get sick by intention, right? So let's say if based on R naught, if high R naught, high threshold, but I will not go into detail. Now, the idea is when healthy people get sick together as a group, you can protect people who are vulnerable, like old people. So, if the society as a whole, if we get sick, automatically you can protect few less number of vulnerable or sick, weak people. That was the basic idea. So some countries said it's all right to get sick. Then many people get sick. Automatically there will be a antibody built in your body. Therefore, you won't spread anymore because once you get sick and recover, you won't spread to other people. So that was also thinking. And actually, UK wanted that, so they didn't take it very serious. They say, okay, let's get sick together. I'm just simplifying. Huh? So if you get sick, 50% of the British people get sick, and therefore you can protect other 50 who are vulnerable. But it was very dangerous choice. Therefore, they changed it. But one country successfully, to some extent, did that. I will first explain to you what is herd immunity with this video. So basically, the very simple idea is you get sick to prevent spread of the COVID-19 to more vulnerable people. Can you see my screen? Video, YouTube video?
No, sir. Not yet.
Okay, this is about herd immunity.
What is herd immunity? Picture a community or herd of healthy people. An infectious disease would pass easily through the community from person to person. Vaccines train our immune system to protect us from diseases it hasn't come into contact with before. For example, the MMR vaccine provides immunity against measles, mumps, and rubella. During an outbreak of a disease, vaccinated people will remain healthy. As they won't become infected, they won't pass the disease on. When most of the community is vaccinated, it makes it difficult for the disease to spread within the community. This is called herd immunity. If more people within the community remain unvaccinated, herd immunity can break down, allowing the disease to spread more easily. Herd immunity is especially important for individuals in the community who can't be vaccinated. For example, if they're too old, too young, or have weak immune systems.
Okay, so the idea is now normally you get the herd immunity through vaccination. You do a vaccination program, and then a lot of people get immunized so that they won't get the disease, and so therefore they won't spread. Now, by doing that, you protect people who are children, maybe old people who can't get vaccination. But now, since there's no vaccination, now other option is you to get sick first and then develop antibody in your in your system. So that is why, for example, people who get normally virus diseases won't get it again. So that was the idea, but it's very expensive in terms of number of people get disease and get number of deaths will be very high. So that didn't work very well. But Sweden as a country, they are normally Swedish people are very different to other people in other countries. I lived there for 4 months. They are very, very advanced people. I would say it's a very advanced society. So they followed. They didn't listen to World Health Organization. They didn't follow other countries, and they did it. It was, of course, criticized inside the country and outside, but they also managed very well. So let's look at how Sweden practiced herd immunity against COVID-19. Let me reshare again.
What is herd immunity?
Oh, sorry.
Picture.
Sweden. copy. When I am, when I am changing it, you can ask the questions. I can do the multiple tasking, but it takes time to change it. And okay, I think I have made let me just search it. I made a wrong URL. Again, I want to till it comes. The idea is herd immunity as a policy measure. You don't try to avoid by locking down a curfew or by asking people not to stay out inside home. You encourage people to do their normal life, of course keeping some distance. But the assumption is that it's okay to get healthy people affected by the disease, because that will act as a shield against weak people. That was called herd immunity. So Swedish policymakers, they went ahead with that approach. Let's see how they have done it.
The streets of Stockholm don't look all that different from how they did before the pandemic started. As countries around the world are trying to flatten the curve through lockdowns, Sweden has gone in the opposite direction, avoiding drastic restrictions on public life. Social distancing is recommended, but with schools and businesses still open, the government is reporting thousands more coronavirus cases and more deaths than neighboring countries.
We trust the system in a way that I think more other countries maybe don't as strongly. So maybe that also plays a part in why Sweden doesn't feel that it's necessary to put such forceful measures at this point until the case worsens.
Sweden is prioritizing herd immunity, a strategy that was considered by other countries but abandoned because it would overload healthcare systems.
Man ska inte gå till jobbet när man är sjuk. Man ska absolut inte nu av flera olika skäl besöka sina äldre anhöriga.
Dr. Anders Tegnell is the country's chief epidemiologist and the architect of its coronavirus plan.
I think all countries, all epidemiologists you talk to will agree that herd immunity is the one thing that will eventually slow down the spread of this virus. Nothing else will slow it down in the long term. Either you reach it by people getting infected and getting well again, or you reach it by vaccinating people. And the vaccine is so far off. Most countries are trying to do the same thing. We're all trying to slow down this epidemic as much as possible, so our healthcare and social welfare and the whole system keeps on working. We do it by slightly different methods, and that means that in Sweden we have used a lot more voluntary means than in other countries, because that's the way we usually work.
But Sweden's scientific community disagrees with Tegnell's strategy. Last week, more than 2,000 doctors, professors, and researchers signed a petition urging the government to introduce more aggressive lockdown measures.
I think that is a tradition here in Sweden that we should trust the authorities, we should trust their experts. But I'm a scientist and I don't trust authorities, I trust data.
Dr. Cecilia Soderberg-Nossler believes that prioritizing herd immunity is dangerous and can't be justified.
The problem with herd immunity is that we don't have any data on this yet. And I think that we shouldn't be the first ones to test it. It's an experiment that I didn't give my informed consent to. And many with me have not done that. The data that we at least have access to and the development that we've seen in different countries just say that, no, this is not a path that is safe to take. Nothing is safe here because many people are going to suffer.
People are already suffering. The death rate in Sweden is accelerating faster than other Scandinavian countries. And even with efforts to keep businesses open, the economy is still predicted to shrink by up to 8% this year. Dr. Tegnell still defends his plan.
I think there is no data that anybody uses that can say anything about the evidence of any method we're using today. We are in completely new territory, all of us. So we're actually following the development and we are looking at how well this social distancing works, and so far it seems to work reasonably well.
Okay, so it's the Swedish style of managing COVID-19. Now, so basically, what I wanted to share with you with the video thing. Now, there was no one like best method of managing COVID-19 when it emerged, maybe from March or even from January. So China did like a very authoritarian style of locking down entire cities and entire provinces. Now Sri Lanka to some extent followed Chinese model. Army intervened, and then you did a lot of curfew and quarantines and everything. But other countries like Germany did more on R node. Like for example, countries like Italy, they even lost the control of whatever they have been doing. But Sweden, on the other hand, they did a very relaxed herd immunity method, and then didn't do any lockdowns, and they were able to manage to some extent successfully. And the US, for example, also now they are having difficulty because they didn't take it seriously, and then they kept on talking. Now we have to understand US has one of best, they have a lot of capacities on health and infrastructure, money and everything. Still, they were not able to control the virus mainly due to political problems. This is discussed in the case. But important thing is now when this is a new challenge, each country, each scientific community, each in World Health Organization, they learn by practicing, they learn by doing. But data is the key, and not just belief on historical experience or your gut feeling or belief system. But you have to apply data, you have to try, and then try and see what works. So as I have already noted, in Sri Lankan context, we didn't do any predictions. We didn't do serious future forecasts. And so therefore, that is why it's not very known here what kind of method we follow other than what happened. Now, I made a joke a few months ago. This is like a Joan Bass method. You get a person and then isolate and then say this happened, and then they take control. But there was no predictions about the future, how you're going to manage. So there's no, at least in the public domain, we didn't see. So what I did was I did some videos sometimes ago, applying R note and other concepts, flattening the curve to Sri Lankan situation. I will not, they are long videos. If you are interested, you can watch later, but I want to just show you very quickly what I have done, based on my interest, based on other countries' experience. Just a minute. If you have time, just I have a YouTube channel, and I have done some specific videos. Let me share with you. So this is about R node and how to use that concept in managing flattening the curve in Sri Lanka. Everyone, and welcome to Satellite Makabura. I will I have discussed this and use one. What is the meaning of R node, and all these things are there. Of some of the videos I've mentioned here, and also I predicted the R node, and then number of people get sick and all these things. Please watch if you have time. I will not go into that now. And also, I also did another video on herd immunity, how that is applied in Sri Lankan situation. And also I share. These are like 45 minutes, 1 hour long videos. Now again, I want to highlight you, I'm not a medical expert, but I was disappointed that those kind of concepts are not available in Sri Lanka for us to view. So that is why I decided to learn it and do it myself for other people, for the benefit of other people. I did one. Okay, so what I did was how they care control Based on available information using other countries' example, I apply to Sri Lankan context and explain these concepts. So that please, if you have time later, you can watch them. The point is, science is the key here. Not somebody use heavy hand like military or political leaders. It's about how to manage a medical problem in a scientific manner. That is something you have to understand and also support. Okay, you can see the screen, right? Back my PowerPoint.
Yes, we can see.
Okay, so very quickly, I will just go to the next part of that. Now, for example, we know about COVID-19 as a health problem. So how to prevent, washing hands and wearing masks, those things are available in Sri Lanka, and then you know how to detect whether you got COVID-19, the symptoms, cough and headache, and all these things, and the complication which will affect your liver or kidney or those things. I will not go into details, and of course death. So COVID-19 is a serious health problem that we already know, and it's discussed in the public forum by doctors and other policymakers. So that is an important thing. You have to pay attention to that. There we can't help. Even I can get COVID-19 tomorrow. So that is a serious public health problem. However, this problem has been to some extent solved by countries like New Zealand, for example, a very good example. Taiwan, South Korea, Germany. Now, I found this small video again. Maybe I'll show you. Please, this is about how South Korea managed it. It's a very interesting example because South Korea is not much like a high-profile country like Germany or UK or Sweden, but it's an Asian country, and they got the disease from China. And you can see very similar situation in Sri Lanka, but look at the difference they made. So I want to ask the question, think about this when you are thinking about Sri Lanka, how different we manage compared to South Korea, how similar we were in situation. This may be my last video.
Testing is absolutely critical, especially with a fast traveling virus like this. And so I think our testing capabilities are now, the toast of the town, if I call it that way. We have tested over 350,000 cases so far. And many times, some patients who are found to have this, are tested many times before they're released. Before they are confirmed fully cured. But altogether, I think we're talking about something like 1 out of 145 or 150 people having been tested so far. Even though we have acted early, much of this has surprised us, and most of all, how fast it travels. Our case number 1 was on January 23rd, a young Chinese woman who was traveling from Wuhan to Japan, in fact. And we caught her in transit at the airport, displaying very severe symptoms. Between her and up to 31, it was a really meticulously managed case up to 31. But after case 31, it just exploded. And, containing the spread was very difficult. Our sense of crisis at the time was very much the same as the sense of crisis that many fighting this in the European countries are feeling, just being overwhelmed. the key to our success has been absolute transparency with the public. I mean, sharing every detail of how this virus is evolving, how it is spreading, and what the government is doing about it. Warts and all, Prime Minister formed a task force of all government ministries and crucially, all city and provincial governments. We are a very devolved governance structure. City mayors and provincial governors are all directly elected. So we are a vibrant democracy that is also very devolved, and it was very crucial to make sure that what we did together. For example, when this region ran out of hospital beds, we asked other provinces to open up beds in their hospitals. This is indeed a global challenge, and we all have to overcome this together. It doesn't matter that my country is stabilizing and coming to grips with this. The world together has to overcome this together.
So if you noted, the Foreign Minister of South Korea, she mentioned very interesting points. First of all, they have managed this by early, adaptation and investing in testing, and also she emphasized the importance of democracy and information sharing with the public. And this was done by doctors and political leaders, and this was a very distributed or decentralized approach. Sri Lanka normally have a very centralized approach by army or at the central government. This was done with the local government, and she emphasized on the democracy. People should know that they were educated, and also they took actions in the early stage. But there are some similarities. For example, prevention by quarantine, and then closing the schools and large gatherings. So, but this is a very good example. Now, the point I want to highlight here is, normally in Sri Lanka, we normally don't look at benchmarking, or we don't look at the best practices. So now South Korea, country like South Korea, now they were not good in all the times, right? They were very bad when they had SARS in 2015. A lot of people were killed. So the learning from the previous example is a very important thing, which I don't see much happening here. So I want to quickly ask how you, for example, up to now, based on your knowledge you have and what you heard from up to now from different examples, how you think how we have done? We will have a discussion formally later, but I want you to just quickly think about it and give you some ideas. How you consider Sri Lanka's response? Of course, we have less than 3,000 very low cases and a few deaths. Results are good, but in terms of processes, in terms of decision making, in terms of looking at this as a scientific problem, how you consider, or even the involvement of the political and policy leadership. Any ideas? Okay, we will come to this. At the end, I will ask you the same thing about Sri Lankan COVID-19 response. Now, there are other implications of COVID-19 except the health issue. There are main issues, for example, in terms of economical implications. Now, we have to discuss this also in detail. For example, let me share you the case now, particularly if you look at the the content from for example, these are how countries manage their stories from different countries. But If you look at the implications for economic domain, mainly about supply chain and demand shock, we'll discuss there, and how economic policies have been adopted by different countries and what are the applicable economic policies. We'll talk about them also. But now if you go to exhibits, the exhibits talk about implications in terms of global GDP, how it has gone down, as you can see from exhibit 1. Exhibit 2 talks about implications for the future growth in different countries or different regions. And this exhibit 3 is about the timeline from January to now. This is till March here. And these things we discussed from different graphs from World Health Organization. And this is about this race for vaccination, how different companies and countries are in the progress of going for vaccine. Exhibit 6 talk about implication on stock market or stock exchanges in the world. You can see all stock exchanges or all the indexes are down globally, so it's a real crisis. Crude oil price went down, the petroleum prices. Now in Sri Lanka there's news that petroleum prices are now less than zero. But that means there is distortion in the markets, and then capital flows across the countries. This is money transferred from different countries to their home country, for example, for migrant workers. A lot of all these are very negative, right? So the economic conditions or economic impact has been very drastically negative. So let's very quickly look at them also. Economic impact of COVID-19. First of all, if you look at supply side, the global supply chain, we talk about the global supply chain. I'm sure you learn about that in your other subjects. They were disturbed, right? You can't anymore import things from China. Now, of course, a lot of things are made in China. When the China was hit, the manufacturing was disturbed, and therefore, a lot of, including your computers, iPhones, to a lot of stuff were not available because China was the key manufacturing hub. And the very important thing was medical supplies. There was a discussion, even we contributed to make, these ventilators, because some countries stopped exporting medical equipments, drugs. Sweden stopped, India stopped also to some extent. So imagine if this continued, you won't get drugs, diabetic, heart patients, drugs from other countries. So medical supply is a big problem. Local markets, I don't know where you live now. I'm from Kurunegala originally, so the markets were closed, and therefore people, the sellers, the farmers, they came to the streets and they sold their harvest there. That means a lot of damages and wastages. So local markets were disturbed. Production, big companies stopped production, including car manufacturing. And Sri Lanka also, you might have noted, garment factories stopped, no jobs, but also no production. And due to social distancing and especially border control, now, for example, I had to cancel 2 visits, one to Brazil and one to Germany, because they don't allow for us to go. There's no planes to go. If I went there, so I had to get quarantined. But this is a big problem. For example, people in Sri Lankans in Middle East, they're still stuck. They can't come home. The last point is food production was disturbed. Fortunately, we didn't feel it very seriously, but some countries, they didn't have anything to eat for days. In India, you might have seen people are walking hundreds of kilometers to go home because they got lost. It's a big country. They stopped, imposed curfew one day. So there's a big demand supply shock. The other side is demand shock. That means market collapse. For example, this was after 1930s, just before World War II. This was something similar. That's why IMF called this as a great lockdown. Even though we call a curfew, it's like lockdowns. And the entire world, whether developed countries or developing countries, they had to stop their operations. So everything was disturbed. Stock market collapse, I already showed you. Increased unemployment, people were fired from their jobs, no salaries paid. So increased unemployment in the country like US, for example, this is very clear now. People are having a lot of problems with jobs. Even in Sri Lanka now, you see some people have lost their jobs and salaries are cut. Now even if you come to Colombo now, you can see the town city centers are not very busy. You don't see people in as you used to see. So people are still not confident to spend money and have their lifestyle back. And in international trade, so our export and imports both were affected. Tourism internationally affected. Now not many people anyway tour internationally. Sri Lanka is really affected because of that, because we rely on European and Western tourists. But these are general global issues. But for countries like Sri Lanka or any developing countries, now if you get, for example, if you are not working in developed countries, you get some dole or some money. US or France, they distributed money among people, but ours was there, but like 5,000. So there's no insurance, for example, for such kind of so a lot of people are affected. We don't have enough healthcare. If everybody gets sick, number of hospital beds are limited. Now a lot of people now in Sri Lanka, there's no rule, for example, for private sector people to maintain their jobs. Some people get job. I think government is trying to have some agreement with the private sector. So job insecurity is a problem. But in addition to that, a lot of people don't formally work. There's a big informal sector. People work like daily wages. They get money only if they work, maybe in the factories, maybe in tea plantation, and also in normal SME sector. So these people are really losing, their livelihood. And big problem with Middle Eastern or Korean people. They lose jobs and now they can't come, and also they can't send money. So these are the same, some special demand shock for countries like Sri Lanka, developing countries. So what are the possibilities we can adopt? Now there are main two domains of possibilities: economic policies. One is fiscal aspect, that is the government now can stop long-term investments, for example, building bridges or grounds or stadiums, and now focus on everyday problems and people's general current demand. And then government can, and they are also all over the world, they encourage this stimulus package, so that give money and different benefits to people so that they can spend and economy will come back. I think Sri Lankan government is also trying to have some stimulus packages, but they are not very yet fully finalized, or maybe not known much. And then special funds, European Union and other countries develop like COVID-19 funds. WHO also has a fund, and of course Sri Lankan government has Itukoma or something that's for the COVID-19 special funds. So there, likewise, there are some other such fiscal policies. Then they have monetary policies, reduce interest rate. Now you might have noted this president's direct public attack on central bank was based on this. Monetary policies are normally central bank's role. So they were asked to do this. I think now they have reduced the interest rate, and then they give bailout package to different companies and different industries, particularly companies like tourism. So the tourist hotels will get some benefits from the government, or SMEs. So this is like giving away money or making money cheaper. And now Sri Lanka is one of main country to apply loans or funding from IMF and World Bank. So these are some policies countries can adopt, and countries have adopted. There are goods and bads from both, but this is what's happening around the world as discussed in the case. Now let's look at challenges. Now this has been more than 6 months now. What are the challenges? You can't say after COVID-19, but maybe COVID-19, current situation. Definitely there should be new norms. For example, you can't anymore, handshake. Now I lived in Spain for 1 year. Their normal greetings, like when you say "Aibo," they hug, and kiss in the cheeks. But those kind of practices we are rethink. Handshake, business meetings and sitting in the restaurant. So a lot of things will be changed. And whether it's education and other stuff, how you gather all together in in community gatherings. Those things should be rearranged or rethought. Technology adaptation is a big thing. This is something where I am working. Digitalization, applying Industry 4.0 technologies for education now. Even though universities will be there will be a lot of physical one-to-one personal lectures. But now things like Zoom. Now we have been doing Zoom, like myself, Google Hangout, Skype lectures for last 10 years at least. But now everybody who has not even come to internet, now they have to use such technologies. So you can see technology now. COVID-19 forced many people to adapt technology, not only for communication but a lot of other things: automation, robotics for factories, even for there are a lot of artificial intelligence, and I work also in 3D printing. So there are a lot of opportunities now for new technological adaptation. That means not necessarily good, because some people lose, some people will have to relearn their skills, some people will lose jobs. So this is both positive and negative. And a lot of countries are now still trying to look at how they can release the restrictions. Now in Sri Lanka, we have, because of the elections and current priorities, we have got some kind of exit strategy, but it's not really formulated. So you can see sometimes maybe curfew will come back again. Then you have to have these public health directives. So countries have to seriously plan how you go back to normal life. What are the new things you can do? What are the things you should do differently? Now, big discussion nowadays is about second wave. In Sri Lanka, there's an argument that is already here. I also think that we are having kind of second wave, but government is assuring that still that we have not be afraid, but it's still debated. The final point is very important. Now we have seen up to now, for example, America or US as a main leader in the world for a lot of things, for technology, security, and a lot of other stuff, economic support. But you saw as a result of that, US lost its credibility because they couldn't manage the the COVID-19 well. So it has very bad impact or implication on American image. So there may be some other new leaders, can be China, at least their power has increased now. Countries like Germany, for example, they were able to, demonstrate the world. If you invest more on health and public safety of people than just looking at only growth or only economic prosperity, in this kind of situation, these countries cannot perform well. Countries who spend free education on free health now are doing better than countries like United States or even UK. So there may be a discussion that new order will be there. Okay, so this is basically about the case. Now I want to ask some questions. Now I want to open quickly for the discussion, maybe for 20 minutes. But these are the questions I want to ask from you. Now, what are your thinking? How you think world is going to be changed by COVID-19? And maybe we should not worry much about other countries, but what are the approaches taken by Sri Lankan government, Sri Lankan policymakers in managing COVID-19? And what are the challenges we face as a country when reopening and when going back to normal life? What are the main issues, both health and economic issues, policy issues? And how will post-COVID-19 world will look? We talk about Spanish flu 1918. You saw some changes, particularly like the introduction of global health or universal health, free health. That is how countries like we got free health for every citizen. It's not the case for all the countries, but likewise, what will be new changes in your life, in the universities, in the world, in workplace, and society in general? And what are the challenges and opportunities for you as young managers just who are going to pass out quickly? What are your, what are the opportunities and challenges for you? And what will be your role as a manager who learn disasters? So how you can use disaster management knowledge and skill to solve some of the future problems. Maybe you can also think about this. For example, this is a disaster management cycle. I'm sure you have learned this. Now imagine now this is your crisis, is COVID-19. Now this is the response. So what should be and how it should be, like, in terms of managing the COVID-19 response and recovery. And have we done enough in preventing it? Have you been prepared enough in understanding and managing? So you can think about disaster management cycle and give your comments. Okay, yes. This is your time. You can ask questions, your contribution and comments on these topics or anything else you want to share with me and with the audience. Let me check the chat box. Okay, yeah. So guiding questions. I think we should discuss the guiding questions. But I will just, at the beginning will be any question. How to influence the location, climate, Sri Lanka, is advanced or disadvantaged? Okay, I don't exactly understand the question by Samira, but I would say now being a tropical country, we have advantage because we have hot weather. It's not scientifically proven, but even in cold countries, now actually, for example, in countries like in Germany or France, it's now summer is not, I think it's already summer, that's been warm. Normally, it's understood that the spread of disease is lower in hot weather. So therefore, it's an advantage for us. But you have to also understand, since we are island, we can easily also get isolated from other countries. By closing down airport and port, we can stop people coming here. But then there are disadvantages also. For example, now we have a high population densities. Now, for example, that is what happened in Navy, Valisara, and also Kandakam. These are concentrated places where people live together. This is also applicable to factories, plantations, fisher people or slums where people live together. You get if one get disease, others get also quickly. But in countries like, for example, say Canada, for example, the people live far away, they have big land, so you can easily stop the spread. So advantages and both advantages are there, but basically being a tropical country, we have a natural advantage. Any comments and questions? Open your mic and speak. I was informed that you are very active in discussion, so I kept some time. Maybe you can also try to answer these questions. I will share it here.
So we have a question from AJ.
Okay.
He is asking, hi, this is Dr. Chintaka Jayananda from University of Derby, UK. Thank you, Chaminda, for the interesting session. And how important example countries continuing to learn from various other contexts rather than being complacent about achievements.
Okay, I think that's a good question. I have to acknowledge Dr. Chintaka, who has been also involved in different projects. Since he's in the UK, maybe he's interested to know. Actually, that's the one complaint we get as Sri Lanka. We normally like to celebrate even without getting the real victory. Now you might have seen the video. We say, okay, we have finished successfully, and as we have done in the war, so we are successful and we are number 1, we are number 10. So president should get this credit, or prime minister, government, blah blah blah. But that's not actually what many successful countries do. They always, if you can remember from South Korean case, South Korean foreign minister clearly said, we can't celebrate that we stop or successfully manage it as far as it's a global issue. So we need more solidarity globally, learn from each other, and also look at our weaknesses. For example, if you statistically look, we are not doing very well, even though our number of deaths are lower. We have 2,500 or slightly more than that. Now, if you remember, in April, May, Ministry of Health Director General said we will stop or try to control this by 500. Now, I predicted based on the global indicators, it's also shared in my Facebook, this will go at least up to 2,424 deaths. Deaths actually not happen because that's the percentage. Mortality rate is one I calculated, 1%. But we don't even know whether this number of people, 11 deaths, are actually real numbers, because there are people died by immune and other stuff. So very important to look at different countries, their success stories, best practices, and adapt them and discuss them. Like as I told you, what Sweden has done, how South Korea has done, how New Zealand has done. So then have a public discussion and then adapt some of them without thinking we are the best and we do extremely well. This is a negative thing. So I will agree with Chintaka. I will say that we need to look at more openly and understand than celebrating early. Trump, for example, did the same thing. He said there's no COVID-19, it's easy, it will go away like, I don't know what the word he said. He didn't take it seriously, and now Americans are facing that because the leadership didn't take it very seriously. Okay, I hope I answered.
Oh, yeah, you did, Chaminda. Thanks for that. But that led me to a couple of other questions. The reason I joined is I'm interested in knowing the context, Sri Lankan context, and how it's been managed in the Sri Lankan context, of course. You mentioned about the military handling disaster. This is a question I've been asking as well, and I know that I'm aware that you've been asking the same question. How capable a military in terms of handling a pandemic? Any thoughts and any ideas? I thought it might be useful.
Yeah, I discussed this actually at the beginning with many people from the health sector, like the doctors. Now they said they cannot, for example, they don't have capacity to do quarantine. For example, large number of people contained in some places. So even if they tried, people don't listen to them, because at the beginning, one advantage we had was we had large military and their facilities. They were able to quarantine people. But I would say now, handling the COVID epidemic by military is not very common in other countries. Many countries we have seen it's done by virologists, epidemiologists, and health people. So that now you can see as a result of that, for example, with the case of Navy cluster, so that shows that Navy was not able to practice so-called health practices inside the camps. So I think having engaged military in managing epidemic is a very negative thing, but it has given some local benefits by, for example, because our main approach was track and contain, that they were able to do, but they were not being able to manage number of people by reducing the spread. In fact, they kind of contributed to the spread. So it is debatable. I think in general, I don't think it's a good idea, but there are some local arguments saying that it helps to control, and particularly when you have imposed curfew and when the army is coming, people are afraid. So therefore they comply. Now China, for example, they did exactly the same thing. They control people mobility and then stop. This is very interesting discussion because now, as South Korea said, democracy is the important thing, because people should know. Therefore, they can take decision by themselves. But then, if you allow people to take decision, in some situations we see they misuse it. But then it's a debate going on. My personal opinion, it's not really productive, more destructive.
Thanks for the answers.
Yeah. Anybody else has a different opinions? It's also, you can see now we have a very centralized approach. Now everything is, for example, let's say we assign to Prime Minister and President. But if you look at in countries like Sweden, it's the chief virologist or chief epidemiologist is the person who is coming to the television. So we have to also look at why distributed approach local to local regions, and also to maybe different political units to handle cities and provincial councils. I don't know, maybe Grama Sabha, Grama Sevaka, I don't know. So anyway, so you should do that, think about that approach also. Now, to some extent, that's happening, because when you are saying you lock down street, that means a local solution, than giving the curfew to the entire country. So that now I think they have learned it, so they won't now do the impose the curfew across the country, but just isolate some small street or communities and try to contain that. I think that's a good learning. More questions, comments?
So there's a question from Dasun. He asks how the mindset attitudes of the people affect controlling a pandemic. For example, I believe the measure taken by South Korea would not be equally effective in India because the difference in mindset of people.
Okay, yeah, this is a very good question, actually, very good question. I don't have like a scientific answer, but I can kind of share my thoughts. Now, for example, I think that's a very important and valid question, because pandemic or when you are fighting with the invisible enemy, we don't know how to fight. Now, when you are fighting a war, you know this is LTT or this is a terrorist, so therefore you can target and shoot. But now we are fighting with the unknown, invisible medical enemy. So that means it creates a lot of perception issues about, some people say this is because of the curse of the god, some people say this is, for example, due to different reasons, the punishment. So therefore fear, lack of trust towards other people, your colleague, your friend, your batchmate is now the spreader of your virus to you. So you have to be careful with your people, however you like to trust and interact with that. So this is totally changing way we look at others. So, but that is why you need to learn, everybody. It's not medical people's or doctors' problem. It's entire country, entire population should learn what is this, how it's happening, how to control it. So active engagement is very important, and understanding is scientifically. Now the question is asking about South Korea and India. Both countries are democratic countries, but South Korea is high advanced in literacy. People are very educated and they're very disciplined. I have been to South Korea. Actually, it's one of the last countries I went end of last year. People are very polite, nice. They follow the rules and they learn from their history. So it's easy for them the government to impose rules and they follow. Now, my personal experience, the Sweden, Japan, these are countries who are following the rules. But countries like Sri Lanka and India, you impose a rule and people try to violate it some other way. And one problem is people are not literal, they don't read, and maybe they don't think about the scientific way of looking at the solution. They believe in the religion, maybe in their gods. So we also have these kind of practices. But I think based on what we have seen only with respect to COVID-19, I think we are more alike South Korea, because we follow and we confirm. I mean, I am talking about people, except people who travel when there's a curfew and there are few people, but otherwise Sri Lankan population confirm to the health authorities. They watch TV and then listen to the Director General of Health. Until Jasinga, he became very popular among people, and this police guy Ajit Rohana. So that means people are listening and watching and then follow. So in this situation, our attitude has been good, but I still think we can improve. For example, believing in some fake news and religious way of looking at this, it's not going to solve the problem. So you look at rationally, scientifically, and as as community, and also you have to help other people. You have to trust other people, even though the COVID-19 is a big problem, but it will be temporary one. Interaction with people, trusting other people is important thing. So just to summarize, mindset, attitudes are very much important, and we have to not now this is another thing. Now in the policy level, if you look at media channels and even public, especially people who are handling it, considered these are drug addicts, these guys are bad guys, these people coming from Italy are bad. This is not, should not be the case. They should treat everybody as victims, because this is a health problem. Anybody who got affected by coronavirus, whether it's a drug addict, whether it's a Prince of Wales, they're both equal in terms of medical life. So therefore, you have to treat them with dignity and respect. So that is something I'm thinking at least missing in media manifestation in Sri Lanka. So we should improve our attitudes, but we are not done very, very bad. Okay, there's another question last. Okay, so yes, the question is, can we, if this continue for 1 year? Of course, this will continue for more than 1 year according to existing information globally. Can we continue with same strategy? Of course not. We have to learn. That's why adapting, you know, you might have learned in disaster management lessons, resilience and adaptability. You know, adapting new condition is a very important thing in survival. You know, bouncing back. So you have to learn what's happening around you, to change your strategies and adapt to the new situation. That is what we have seen in Spanish flu, we have seen in tsunami. So you don't think like when sea goes back 1 kilometer, you won't run to play there or take pictures as we did in 2005. Likewise, coronavirus taught us a lot of new, you know, messages, new lessons. So we have to learn and adapt and change our behavior. That's important. One thing missing, I think this is an opportunity for the people, young guys like you, document and record this. Learn lessons and document. We don't have many people doing research on that. So it is as opportunity to do your research, maybe your thesis, your project related to COVID-19, and I'm sure you will use that will be useful for next 20 years of your career life. So all disasters are not necessarily negative. Some can also learn and get some benefit out of that. Final question? Any? So it's almost 9 o'clock. I think if you have any question, you can also. Sir. Yeah, sorry. Go ahead.
I have a question, sir. You said that Swedish people get succeeded in herd immunity. How did they succeeded in that? But we see that USA did not success in that herd immunity. They failed. Were they? What was their health precautions like that Sri Lankans have BCG vaccine? Like, did they have something like that?
Okay, yeah. So I won't say it's it has been successful. It is successful comparatively. Now, if you look at neighboring countries like Denmark, Norway, Finland, Sweden condition is not very good. They have high deaths and high number of affected people. Of course, Sweden is a bigger country also. Now, reason for their success, still I won't say it's success, but let's say if you see it as success, because these people are very, very law-abiding people. They follow the rules. I lived there for 4 months. You know, people don't do speeches. You know, if government says to do something, they do it. For example, students, they redesign their sitting arrangement. So you sit 1 meter away, right? If they ask you to wear a mask, you do it. You don't need police to do it, right? Now here, police come and tell you, if you don't wear the mask, you will be quarantined for 2 weeks. So that is not Swedish approach. That is a Sri Lankan approach. You make people fearful and follow the rule. In Sweden, if they understand it is a positive rule, they follow it. So there are no people who violate it. So I can't explain in a short way, but Scandinavia in general are very law-abiding people who think very rationally and legally. So therefore, that may be one reason. However, still it's an ongoing case. But in US, for example, they didn't actually adopt herd immunity. What happened was, since they didn't take it seriously, the numbers went up. but again, then it's different from different states. For example, as cases, New York, for example, they try to control this in a very effective manner, but some countries, even now, some people in the US think COVID-19 is like a fake thing. People created it. It's no real problem. There are people who are believing like that. Now, I think we can look at the comparative example of UK. UK wanted, originally they were trying to go for herd immunity, but they realized that it's going to be very costly in terms of number of deaths and number of economical damage and everything. So they switched. So as Swedish guy said, they are also adopting a new policy. So it's not really herd immunity, but herd immunity combined with social distancing. And you can eventually say one successful, not only when we completely finish COVID-19. Still, it's an ongoing process. So you can't still say, it's somebody is successful.
So participants, I can give you few more minutes. If you can have any questions, you can raise before winding up.
And if you want, meantime, to contact me, you can, either contact me on my Facebook or LinkedIn, or I have a YouTube channel also, and my number is there. Email. Please stay in touch, and if you need more information, I am happy to share with you, because this is everybody's problem, and I'm very much voluntarily trying to involve in the problem of COVID-19 in Sri Lanka and try to learn myself as well as share with me others what I know. Yeah. Yes, Nathmini, do you have any other questions? If you plan to do any research thesis, you can contact me, and I'm happy to advise you and help, find resources locally or from outside.
I think since time allotted us is going to end, we have to wind up the question and answer session from here. So dear friends, we have come to the end of such a great session. Before winding up, I would like to invite Samira to deliver the vote of thanks.
Thank you, Nathmini. Very good evening, all of you. Today, we got some new knowledge about Harvard Business School case discussion on COVID-19 global shutdown. I think this session is very valuable for us because the current situation of global as well as Sri Lanka. So first, I would like to thank our resource person, Mr. Chaminda Heettiarachchi, for joining and sharing such kind of valuable ideas, knowledge with us, even you are in a busy schedule. As well as our subject lecturer, Mr. I.A. Ekanaka, for encourage us to this webinar series. Also, we must remind our head of the department, Dr. Rasika Piyankara, for always being behind with us. And also, I'd like to thank all the participants who were joining us this valuable session. Thank you, all of you.
Thank you very much for having me. It was a pleasure, and I'm very happy to continue my contribution and collaboration with you, and all the best for your study, particularly your subject of disaster management. And I hope to see you, some of you, during my MBA classes, maybe after 2 years or something. I don't know, whenever you are qualified to do so.
Thank you very much, sir. And thank you very much, Samira. So everybody, once again, thank you very much for joining. And don't forget to follow every precaution to prevent by infecting the virus. Be safe and make sure your family is safe too. Thank you very much for joining.
Ciao.